Okay, good morning, everyone, and thanks for joining in this session today. I have, I think, a couple more learners waiting. I'm just not going to obviously keep you guys waiting. So as they join, we will accept them in, and they can then, start with us on that session. Now, what we're going to do is, for the benefit of a couple of you who have joined in today, what I'm going to do is basically do a bit of a brief introduction so that what we are able to do is follow up on this particular unit that we are looking at doing, which is research and the importance of research in, health and social care. Now, this is a generic unit, and at level 3, we are looking at primarily understanding why research is done, why you undertake certain set of activities, investigation to primarily uncover, say, for example, details about an event which has occurred, or in the case of health and social care, it could be a disease, it could be a problem issue, or in the case of COVID, for example, there was a lot of companies, pharmaceutical companies in particular, did a lot of research, and that research led to the creation of COVID vaccine. After 18 months, it went through lots of, various phases of development, including, isolating the virus and the protein, looking at understanding the structure of the virus, how it infects, how it multiplies, how it mutates, how it gives rise to various variants. And then at some stage, once the protein was isolated and the vaccine in some shape or form was conceived, the trials began, and trials typically happened on animals first. Then in some cases, once the further corrections were done, at some stage, the trials then happened on humans. There was a trial which was done with about 30,000 people who acted as volunteers. And once the symptoms and everything were, obviously brought under control and it started to effect.
Would you mind to zoom off the page? I mean, the zoom and make the font larger, please.
We can't make the form larger. Are you attending on a phone, or are you on a laptop, or what is it?
Okay, yeah. Yeah,
Okay.
no, that's
okay
fine
like
now.
this.
So
Yeah, you can do it.
in some cases, what tends to happen is if you're joining on the phone, the idea would be to turn it to a landscape mode, and that would allow you to see a bigger screen. But ideally, this is also going to be available later on YouTube, so you should be able to watch it on full screen on YouTube as well. Now, so the trials basically look at, undertaking a series of activities, and these series of activities tend to be related to finalizing the vaccine that we have used now to bring the COVID pandemic under control. Now, when we look at the area of research and we look at broadly why we look at, carrying this out as an activity, is because it helps in the creation of, say, for example, new medication, new procedures, new treatments. And that is what the idea of studying research at this moment is at level 3. Now, it's a very broad topic. What we would want to do is narrow it down to, the understanding that here we are looking at primarily understanding why it is done, how it is done, what are the various types. And then at some stage, what we also want to do is primarily look at understanding, if you were asked to carry out research, how would you undertake some of these activities to look at ensuring that, you come out with meaningful information. So when we look at the process of research, it is a process wherein we will look at this by undertaking a series of activities. Investigation, they could follow a particular pattern, and they tend to be generally primary research, secondary research. There are methodologies, strategies that you would use to be able to carry out this set of activities. Now, this particular unit is divided into three learning outcomes. We are looking at covering this to understand broadly how research as a whole process works. So the first part that we are looking at today, which I will probably look at a bit of summary, would be to look at understanding the role of research and the different approaches it can take in health and social care. That's the learning outcome, or the overarching, requirement of understanding why we need to look at doing research in health and social care. So sometimes it is to carry out in-depth investigation of a problem, maybe a case, or a behavior which is linked to a particular individual. And in some cases, we are looking at, obviously trying to understand new treatments, inventions, practices which can be brought into play because of the evidence that these tend to work. So why do you take a particular medication for a particular type of symptom that you have? So if you have fever or if you have cold and cough, we end up taking, say, for example, Nurofen or Cocodamol. Why do we need to do? Why do we know that it works? Is because over the years a number of studies have been carried out, and obviously these studies have then confirmed that this is how this medication helps in that in the treatment of that particular symptom or the fever or the problem that we are having, cold and cough. And this is where the advantage of carrying out research actually comes in, because it helps uncover finding new knowledge, and obviously this knowledge leads to then development of new treatments, new policies and procedures, which are then implemented across hospitals, A&Es, surgeries. And at some stage, this also informs us about what kind of care needs to be provided, medicine needs to be administered to help patients get rid of that particular problem or that particular disease. Now, there are lots of ways in which research can be done, and we will look at one such particular way, and we will get into understanding the approaches to conducting research. Now, in the second learning outcome, we are going to be looking at identifying a topic, and that topic that we look at identifying will be primarily used, to understand how would you carry out research. So here I'm going to share a template which is primarily going to give you two websites, which one of them is the NHS website and the other one is the Health Foundation website, wherein there are lots of research reports which are published. And the idea of going to these websites would be to try and shortlist a report or a topic which is of your interest or interest to you. And when you download that report or that topic report, which is basically in that chosen area of your topic, you download a research report, then the idea would be to try and understand how the research report has been compiled. What are the various chapters or structure of the report in terms of how it has been divided, written, and published. So the idea would be to try and understand that. And broadly speaking, when we look at research, we are primarily going to be looking at structuring the report out into 5 broad chapters, and they tend to be the topic of the research, the rationale of the research, which is covered under introduction, including aims and objectives. Then you have a literature review, or you carry out the review of existing material which is available in the public domain, either through government reports, published data, books, articles, journals, and you collate that and try and relate it to the research or gather information which will be helpful for the research or research activity that you're carrying out. The third tends to be research methodology. How would you go about carrying the research? Whether this will be done on a field-based study, whether you will do a desk-based research, what kind of approaches you would look at. Would you go in and look at sampling? Would you look at speaking to individuals, do interviews? So the methodology is all about looking at philosophy, research strategy, and the type of techniques that tools and techniques that you would use to basically carry out your research. It could be questionnaires, it could be surveys, things like that. And then the fourth chapter tends to be when you've collated all the information, you basically go about analyzing it, filtering it, and then presenting it in some sort of data, forms, graphs, which basically can be used for making or coming to meaningful conclusions. And the last chapter or the section tends to be, your conclusions. What are the findings of your research? How would you conclude whether the study has been useful, has uncovered certain new areas, or shed light on new information? And that tends to be the last chapter of your report, which is called conclusions. And to a certain extent, you also make recommendations. You also look at future areas of research, any limitations that you faced, and that would be covered under learning outcome 2. So limitations could be ethical considerations, things like some people are not happy with the sharing of their own personal data, so you'll have to anonymize the results or hide such information. In some cases, maybe discard those questionnaire or data which has been collected, and they tend to be primarily related to for you to understand how would you look at putting these as constraints, and they generally tend to be reflected in what is called ethical considerations. Now, the last part of the learning outcome that we are going to discuss is going to be focusing on how would you do a review of the existing information which is currently present and how that can be related to the area of research that you're carrying. That area of research that you're carrying would tend to be, for the purposes of understanding that, okay, a simple example, that today we have a COVID vaccine which has been introduced by Pfizer, Moderna, you have AstraZeneca, you have Johnson & Johnson, you have lots of other companies which have introduced the vaccine. Now, how effective is this vaccine? Obviously, the research is an ongoing research because there are new variants of COVID which are being found, the South African variant, the Nigerian variant, the Indian variant, the new Chinese variant, which is coming out, wherein there are lockdowns happening in various cities in China, in Shanghai, Beijing, things like that. Now, that would mean that there has to be continuous research and development to come out with newer vaccines, which will help us curb or get control over the new mutations of the virus, which is what we call the COVID variants as of now. So in those cases, sometimes what you have to do is dive into and look at the existing data or published research or reports, and look at, again, research or look into data which has been compiled by different agencies like the World Health Organization, Department of Health for various countries, and then look at what is the difference between this variant and that variant and how the vaccine needs to be tweaked. So the review of the existing data, information, and reports, which is done in order to relate it to your research, is normally called the review. And this is done as a structured process, which is called the literature review. And literature review primarily informs us that what is the existing information available in public domain, how this information is useful for the series of activities that you will carry out when you conduct your research, or when you extend the research to find out a new variant of the vaccine, which will be useful to control the other variants which are coming out, and it will be helping to save lives. And that bit normally is undertaken as a detailed study, and that study is generally called the process of what is called literature review. Now, after the literature review, we are also going to be looking at sampling of data. That means we need to understand what are data sampling techniques, primary methods, secondary methods, how do you go about collecting data, and when you collect data, how do you present that data for which is meaningful? Because if I do a questionnaire on, say, for example, if I have to go across and collect data from participants about a particular, research objective that I'm carrying out, that would mean that I will ask them to fill up a questionnaire, maybe do an interview, maybe do some group discussions, and then write down the meaningful points which come out of it. Now, imagine if you have to do this for 5,000 participants. The COVID vaccine, when it was finally approved by the FDA and MHRA in the UK, essentially underwent testing with 30,000 volunteers. Now, data from 30,000 volunteers, when it is collected, what kind of symptoms have you had when the vaccine was given to you? Did it give you symptoms of muscle pain, cold and cough, sore throat, fever? Every individual would have had different symptoms. So assuming if you had to write down all the symptoms, which assuming the vaccine, some of them did not have any symptoms at all. So assuming you have to collate that data and write it down, at some stage, you would need to use what is called advanced softwares like Qualmetrics and SPSS to be able to collate that data into meaningful information. Now, imagine if you were looking at presenting that data to an audience of, say, UNESCO or World Health Organization, or maybe a government, to say that, okay, we've carried out this test. This is how the vaccine has been developed. This is the process. We've done these tests. We've done the testing, and these are the symptoms. They're all mild, and the vaccine should be approved. The government would want to look at the data in some filtered format, and that would be done through presenting the data that you've collected into a meaningful information, concise, summarized, and that would involve what is called the process of collating the information, analyzing the information, and then presenting it in the appropriate format, which will be useful for management, government, or different departments to be able to make decisions. How do you look at testing the reliability of that data, that information which has been collected, and how do you then back it up with questionnaires and the opinions and the results which you've got from various participants is all going to be covered under what is called data analysis, collation, and presentation of your findings. So this will be covered under what is called learning outcome 3. Now, towards the end, obviously, you've carried out a research, Pfizer, Moderna, some of the companies which did this research, just sticking to that same example of COVID vaccine, they carried out that research for a period of 18 months. Now, after that, in order to get approvals from the Food and Drugs Agency in the US and the MHRA in the UK, these companies then put together what are called reports, conclusive reports, which had backed up information on the basis of tests and trials which were done on various individuals, 30,000 participants, to get the approval for the vaccine, to get the approval to start manufacturing the vaccine. And the amount of money which was spent on creation of this particular vaccine, I'm just plucking out the number from the air, but from what I can recall, between the two companies, they spent in excess of $2 billion to come to the conclusion that this vaccine with this protein and this particular formula is going to be helpful to in order to bring the COVID pandemic under control. And they look at the amount of money which was sent, apart from the time, effort of thousands of doctors, pharmacists, clinicians who basically helped in the creation of this particular vaccine. And that has to be then compiled into a report, which will then give you a report to say, these were the circumstances, these were the assumptions, and this is how the vaccine has been developed. That presentation of your findings is done in the last chapter of your report, and that generally tends to be findings, conclusions, and recommendations of the research. And that is where we will try and conclude, the reading and obviously the understanding of this particular unit, which is research in health and social care. So there are 3 broad learning outcomes, and they are structured in such a way that we should be able to understand the whole process, which is the 5-tiered process of 5 chapters when we carry out research. And that is what the unit would help you develop as an understanding in terms of why research is carried out, how it is carried out, what are the tools and techniques used, how do you present and analyze or collate data, and then towards the end, how do you present these as findings of your report. Now, the first learning outcome is understand. That means it is theoretical. The second one also is theoretical. It says know how to identify. The third one is going to be involving you at some stage undertaking a desk-based research. And that is where these 2 websites that I mentioned, the Health Foundation and the NHS website, would help you download a research report from choosing of a topic that is of interest to you. And that would be useful for you to carry out and summarize that research report in your own words. But you would do this in a structure in about 5 different chapters, and that would form the basis of your assignment towards the end of this unit. So that hopefully should give you a bit of an introduction, with regards to what we are studying for some of you who have joined in today, when we look at this particular unit, which is research in health and social care. Now, in addition to this, what we also want to do is go through some details of what I've mentioned, but we are going to start off with looking at, a presentation, and I will bring that in front of you in a second. And that presentation will help us, go into some of these learning outcomes in the sessions that we are going to conduct in a bit more detail. So let's start off with, a couple of slides that I want to look at, bringing to your attention, which will cover some of the assessment criteria, that are involved in studying, this particular unit. So when we look at today's lecture is more going to be on, learning outcome 1. And what we're going to be looking at is primarily focus on covering some of the assessment criteria, which are, given, here in terms of the learning outcome 1. So let me take you and switch you over to our presentation. And that is what we are going to be looking at today. So is everyone able to see the slides? Right. Now, okay, that's great. Thank you. There are 2 ways, obviously, some of you who have joined, some basic housekeeping tips in terms of, when we do these sessions, feel free to ask questions at any given point in time. If there are points, or if I'm going too fast, feel free to stop me there and ask me questions. Do keep your microphones muted if you're not asking any questions, so that there is no background noise, because the lectures are being recorded. And last but not the least, there is a chat option as well. You can raise your hand and obviously ask me any questions through the chat route as well, if it is related to a particular slide, and I'll be happy to take that and then give you a bit more detail. Now, when we generally do these sessions, we would, start off with a bit of an introduction covering what we've done so far in the previous session, just a bit of a recap. And then I also tend to do is basically take you through some key terminology, which is related generally to the learning outcome that we are studying. And then there are a few slides that we use to discuss the topic in a bit more detail. There are sometimes topics which cannot be discussed in detail on in the presentation in the session that we are doing. And the idea thereabouts then is to also make available a handout to you through Moodle, and that handout will give you more detailing on what we've discussed in the presentation. The sessions generally last between 35 to 45 minutes. In some cases, it can be an hour long as well. And that is where the idea is to have a very detailed discussion, so that when we discuss a particular learning outcome and go through this particular topic, you are absolutely clear that what is the unit talking about, what is the learning outcome talking about, and then you have a very good understanding in terms of taking it further when we look at, say, for example, when we go towards the assignment. Now, because this particular unit is about research, what I'm going to do at some stage is switch between a couple of presentations. And the reason I would do that is because I want to cover the main aspects of why we want to study research, specifically when we talk about research in health and social care. So let's look at some of the slides, and I will take you through the bits and pieces in terms of making sure that when you go through these slides, these are available to you on Moodle after the session. And we also then are able to do a bit more reading with relates to the topics that we are discussing. Now, as I mentioned to you earlier in the start of the unit, we need to look at research. What is research? So if I have to look at a textbook's definition of what is research as a process, it is basically a systematic investigation. Now, assuming, if I give you an example, that if I was coming to the office this morning and I witnessed an accident. Now, if I witnessed it firsthand, I was there because I was passing through that road, or when it happened, I have seen the accident firsthand, and it is primarily something that I've seen with my own eyes. And that is where, if somebody is to ask me about it, I am a primary witness to when that accident happened. So, assuming that has happened and it has had no fatalities, but the fire brigade and the police and everything reached the location, at some stage they would need to uncover why this accident has happened. Now, when they carry out their investigation or a series of activities, they cordon off the area by putting on the tape, and then obviously look at why the accident happened. Were the traffic lights working? Were they switched off? Did somebody else jump the queue or start the traffic, from a different direction? All those reasons and factors would be looked at, but they will carry out a series of investigation. They will follow through on a process, and that process to uncover why this accident happened and could this have been avoided would be a process of researching, going back, rewinding the sequence of events to see and understand in detail why this particular event actually occurred. Shouldn't have happened, but why did it happen? Excuse me. And that process through which they carry out these series of activities, actions to uncover the event is nothing but the process of research. Now, they would look at maybe interviewing some bystanders, people who were in, traveling in the morning. They might do some interviews, ask where the trouble started or who was to blame or who was at fault. And all these things would be involved in carrying out a systematic investigation. Now, what they are doing in this process is collecting data from bystanders, from people who were driving in their cars, got stuck in the traffic. They will look at analyzing some critical information which will come from maybe traffic sources or data which is going to come from maybe the traffic center in the background. And then once they've collated all those things, in terms of, when I say things, met the people, spoken to the witnesses, spoken to people on ground who saw it, collected data, which could be data, traffic data being collected at the traffic center and things like that. And at some stage, some people will sit down and then try and piece it all together. And that process that you do is nothing but the process of research. Similarly, if we do this in health and social care, the idea there is to try and uncover areas in terms of how new treatments can be discovered, new policies and processes can be done. And one such example that I've given earlier is the case of, A&E, or Accident and Emergencies Department. As you know, the Quality Care Commission has set a timeline of 2 hours or less in terms of waiting times for the time the ambulance picks somebody up from a distress call of 999 and then brings it to the hospital, and then they discharge the patient and hand over the patient to the hospital authorities before they can go back into the queue system. Now, this waiting time currently is in excess of 6 hours in certain locations in England and Wales. Now, in order to bring this waiting time down to the desired levels of, what is described by what is expected of by policies and procedures by the CQC, is something which would need investigation. Why is the timing, the timing not 2 hours and it is 3 or 6 hours and 5 hours or 6 hours in some places? It could be that the ambulance is picking up patients from remote locations. It could be the distance that they travel from between the location to the hospital. It could be number of ambulances being less. It could be some of the ambulances being out of service. Loads of factors could be there. So this process through which somebody would undertake and try and find out the reasons why there are delays happening would essentially be the process of research. And that research, which will uncover factors which can be mitigated, reduced, overcome to reduce these times, would be the outcome of the research which will be carried out. So when we look at research in health and social care, there are lots of different types of small activities that we do in the office, in our workplace, and it could be time management. A simple example of you trying to reach on time at the office, and if it's sometimes you get delayed by the traffic, or you get stuck somewhere, or your alarm doesn't go off, you are going to be investigating about reasons in terms of how you would do away with this, and they will all be covered under the topic of research. Now, if we look at certain other definitions in terms of how research happens and why is it required to be done, we will look at a small video, and I want to basically share that small video with you because this will give you an overview in terms of how this process actually works. And in general, when we talk about this process, we are looking at, let me just share that particular video, 1 second. Look at, thanks for that, Julia. Now, what we also look at is when we discuss primarily, looking at undertaking this activity as a research, what we then try to do is basically formulate a research specification, because you're not going to carry out a very broad-based activity. You're going to carry out an activity or a series of activities which are going to be related to certain aims and objectives. And that is where we look at the formulation of a research specification or some sort of an outline which will give us guidance in terms of why this process is being carried out, or why are we carrying out this process of or these series of activities to undertake research. Now, when we do that, we will look at certain guidance, we will look at certain protocols, we will look at policies and practice which are in existence. We will look at things which are related specifically to clinical trials, things like safety of the individuals being guaranteed, duty of care if the volunteers are taking on certain aspects of helping us with the research, and then also looking at safeguarding primarily the individuals who are a part and parcel of the clinical trials. And here is where we look at the policies and procedures which have to be followed, so that if there are symptoms which they show, or if there are complications which arise, then there are clear ways through which they can be dealt with and dealt with promptly to basically able, to save lives or do not put lives, in any form of danger. Now, when we look at the contribution, let's say, what is the contribution of research as an activity primarily, in terms of health and social care sector? Why do we do this research and what does it contribute? You would see a lot of companies, and this is something that we get to see on news, that a lot of companies spend a lot of their income and profits and invest that into what is called research and development, R&D. Now, this is a term that I presume you would have come across frequently when you at least listen into the news, or if you work within an organization within this sector, you would generally see some organizations invest some part of their profit and incomes, which is being generated by the business activity, into what is called research and development. Now, research and development essentially is being done in order to produce better medication, better, let's say, processes, which will help provide better care to patient. And in some cases, when we look at, say, for example, a lot of companies, charities are investing money, and we also donate a lot of money to charities specifically for cancer research. Now, this research has been happening for decades, and we are trying to come up with a vaccine, a medication, which will help us, deal with cancer. Now, there are different various types of cancers. And when we look at one particular type, obviously, as of now, there is no structured medication, for any type of these cancers. Some are curable, some are not curable if they are not detected in early stages. And that is where the companies are putting in a lot of money. Pharmaceutical companies which are related very closely to the health and social care sector, they're working within it. They are trying to come up with medication treatments. And as of now, we know that if the cancer of a particular type is detected, chemotherapy tends to be, along with certain, medication, tries to, bring it under control. But if it's detected at a late stage, or stage 3 or 4, as we call it, then sometimes, in most cases, it tends to be fatal. So when we talk about the usefulness or the contribution of research and development in the health and social care sector, this is a very important activity, and the people which are associated and they carry out this particular activity tend to be called researchers, and they contribute significantly towards a particular study or a topic that they are studying. And the idea thereabouts is that with experimentation, with clinical trials, with testing, they are trying to come out with a medication or a solution to be able to overcome, say, a particular problem, and in this case, say, for example, cancer. So when we talk about research informs about and broadens your understanding about what could be the cause of the problems or the diseases which are coming up, and obviously how they then can be used in terms of diagnosing them early, and then also creating suitable treatments which will be I would put it this way, which will allow patients to get better soon, or will prevent the development or reoccurrence of some of these diseases and reduce the number of fatalities which happen globally on, say, for example, on the cancer side. So research is very important, because the aim of research and research activities is related to the aspect of helping to diagnose diseases and health problems. And these, in terms of further investment, which is done by companies, governments, agencies, is looking at finding out ways to prevent the development of these diseases and these conditions, and then looking at stopping the reoccurrence of these in order to ensure that people, and there are less and less fatalities and people do not fall ill or become ill. And this treatment, which helps improve survival rates and helps improve our immune system by taking on that medication, is basically the contribution which research makes in the health and social care sector. So it is a very important aspect, and an aspect in which companies which are working within this sector invest especially pharmaceutical companies, because they're looking at bringing out new drugs and medication, which are going to help improve services and treatment primarily for future generations. And this then allows, and I can relate this to just by giving an example, that when we look at the growth of human population, I think a couple of days back, I don't know how many of you saw, but the human population on Earth has reached the landmark of 8 billion. Now, if you see how population has risen over the centuries, we probably reached the first billion in about 200 and, in about 200 and, in say, let's say in 250 years. But the second billion, and then reaching the 5 billion, and then upwards to 8 billion has happened in the last 200 years. So when you look at between now and 2050, when the population is expected to rise to 10 billion, and after 2050, the population will see a bit of a decline on Earth, is primarily because of the improvement in health services and medication and treatments which are coming up in the modern times. And that is reducing the fatality, is increasing our life expectancy, because there is better medication, better care, and better treatments available. And when you look at dealing with pandemics, if you look at the pandemic which happened in the 17th century, the bubonic plague, then you look at the pandemic which has happened now, and if you look at the fatalities which happened, there were 18 or 19 million fatalities. And if you look at COVID as a pandemic, yes, we've had fatalities, but they are more in the region of 2 or 3 million, if I recall that number correctly from the COVID tracker. And it is 1/10 of the fatalities that the last pandemic which the mankind has seen. And once in 100 years, as they say, once in 200 years or once in 100 years, this event happens. And this is all because of the developments of better medication, better treatments, and the ability of the ability for us to be able to fight some of these diseases over a point in time has improved because of the investment which is going into research and development, leading to the creation of better diagnosis of diseases, better diagnosis of health problems, and obviously better medication and treatments, which has helped the human population to basically overcome some of these pandemics and fatal diseases which have come up over the years. So the first part that we want to primarily understand in terms of the overall learning outcome is to understand why research is carried out, what is research, why is it carried out, and what are the approaches through which research is carried out in the health and social care sector. And that tends to be generally evidence-based practice research. And this then allows the creation of better, or basically informs us, broadens the knowledge and understanding of why some of these conditions are happening. And then it also helps us uncover answers or find answers to these situations, which will help us in best possible ways to overcome the disease, overcome these problems, health problems which are faced by humans, and then leads to the development of better treatment for illnesses. And that is helping us revive or essentially have better survival rates when these problems do occur. Now, last but not the least, what I want to do is obviously go into and understand how does say, for example, how do you carry out some of these activities when we look at the process of research? So what I would want to do here is basically show you a research template, which I'm going to be providing. And this research template, which I'm going to be providing, primarily would allow you to undertake the activity of research at your end. And this is going to be available on Moodle. So when I look at this particular template, which is a Word document, which is going to be made available, this is going to form a bit of a framework in terms of how we would go about carrying out a desk-based research, for the purposes of this particular unit that we are studying. Now, there are two websites, as I mentioned to you earlier, which I would suggest that you look in detail and start to identify a topic of your interest that you will be looking at undertaking research activity on, is because these two sites have plenty of research reports which are already published. And these research reports which are published if you look at a particular topic of your interest and use that to be able to, then download a research report and then study it to see what I've given you is a bit of a background that how these reports are compiled, put together, and how they look into collecting data, doing analysis, and then presenting the findings. So if I just briefly show you these sites for the purposes, there are links available to these sites on Moodle, but I just want to show you these two sites so that you are able to go ahead and obviously look at them in a bit more detail. So this is the NHS website, wherein there are lots of publications. We don't want to be looking at generic research reports, in business and other areas. We are looking at health and social care. So here in this case, what we want to be able to do is look at a report in health and social care, which is of interest to us. So there are lots of reports, as you can see, which are published. If you pick out one which is of interest to you, either on the Health Foundation, they are listed here chronologically from A to Z. And depending on the topic which is close to you, for example, if I want to look at public health or I want to look at person-centered care, I can go into one of the topics. And then within that, there are lots of different types of reports which have been published. Again, go through some of the topics that you see if they are of interest. If not, then go back, choose a different topic that you feel is going to be of interest to you. And that interest would basically mean that you're going to go through that report and read that report in a bit more detail. So here, if I look at certain types of reports, which have been published, and in NHS, there are lots of different types of research which are done throughout the year by different teams, and these reports are then compiled and obviously published for mass circulation for members of public, because of the fact that these reports are useful and inform obviously clinicians, people working within this sector, practice managers, nurses, doctors, GPs of certain practices that they need to use, or if they need to refer to any data, then these reports would provide that, in plentiful detail. So if I just look at picking out broadly, just one report, if I click on any one, for example, impact of disability on lives of young children, and this report, if I click on it, as you can see, there's a bit of an extract of this report in terms of what is the crux, in terms of why this particular report or research was essentially undertaken. And it was to look at studying the impact of disability. If young children have disability, what impact does it have on their lives? If you want to look at reading the contents of this report, you click on the contents, and then you can also download this, and then they are organized in a particular chapter. So if I can, what I would encourage you to do is, when you go to one of these sites, I would encourage you to download this report. The reason I would say this is that you would be looking at doing secondary research, which we will cover in the next session. And what you would need to do is have the copy of the report with you, because you will read it and then you're going to write it in your own words in the 5 broad chapters that I mentioned when you do your assignment. And that is going to be done on the basis of the templated research proposal which I've shown. So this research report, if it's a topic of interest that I want to understand what is the impact of disability on the lives of young children, I'm going to be looking at reading this report in detail. It will give you basic bits that we have discussed, things like what was the background of why this research was undertaken, objectives, the scope of the research, data methods, that means what was the research methodology and how the data was collected, what are the findings of that report, the research activities which has been carried out and they are published in this report, and then what are the conclusions which have been drawn by carrying out this research. So, and in the appendix, you will generally have, the questionnaire which was circulated, or what kind of, let's say, analysis of data was done using software or, certain tools and techniques. So in this case, multivariate analysis, regression analysis has been done, and those could be presented as findings. Not that you have to do it, but it gives you an idea in terms of the structure of the report which has been published and how it has gone about carrying out this particular research. So this is an important bit, because when we look at understanding research and the activities around research, what we also want to be able to do is see an output of a research which has been carried out, And that would be done in the form of downloading one of the reports and then going through this in a bit more detail as we cover the theoretical aspects of the unit by covering different learning outcomes. I'm going to be pointing out using an example of a report that, okay, this is what is literature review, this is what the research methodology is, this is what the background of the research is. These were the aims and objectives which were agreed by the executive sponsor or the management within the NHS when this particular report was carried out. And then at some stage, the findings of this research, which has been done as an activity by a group of individuals or departments, have then been published as a report, which is available for people to be able to read and obviously utilize in their areas of work if it is relevant to them. And that is what we will need to do by covering this particular unit. Is that okay? Any questions on today's discussion that we have done? Feel free to ask questions if you have any on the discussions that we've done. Okay, so if you think of any questions at a later stage, you can write into us or basically send me an email, and that would also mean that I could then come back to you with, say, for example, further details if you need. Now, just switching you back to the research proposal for a minute, which is the template that I have mentioned will be available to you on Moodle. Now, these are the links to the sites. As you can see, what I've tried to do is we don't want to be looking at doing a research or undertaking a research at this stage, which is going to be like 10,000 words or 15,000 words. What we want to be able to do is undertake, let's say, what we want to do for the purposes of at some stage, once we have completed the unit, when we have to do the assignment, what we want to be able to do is do and present a meaningful assignment, which will help us pass this unit. Now, in this case, what we're going to be using is this particular template, and this particular template has divided the various tasks that you're going to be required to cover in this particular format. So you have the background to the research, aims and objectives, which is the first part in the introduction, the purpose of research. We are going to be looking at what is the focus of your research, the key issues that you're going to investigate, what is the significance, why you are carrying out this research, and then look at what are the sources from which you'll look at reading or collating existing material and literature which is available, in and around the topic that you've decided to go about studying in detail. We'll look at shortlisting and then choosing an appropriate methodology. That means primary / secondary, quantitative / qualitative, and then look at mentioning that here briefly to say, this is how I would go about collecting data and carrying out the activities for research. What would be the places from which you will look at the information that you will gather, whether it will come from published articles, journals, books, existing reports, websites. They will be listed down as sources here. What would be the conclusions which will come out of those activities will be listed down here as a bullet point in 1 or 2 paragraphs. And then the constraints or ethical considerations that we need to be able to look at when we carry out that research activity is going to be mentioned here. So when you start to fill this up, this would start to look like an assignment for this particular unit. And then when we compile and write our report, we are going to basically pull out data which is going to be coming from these particular columns and rows that we have filled. And that is going to be completed and compiled into 5 of these chapters. And we are going to be looking at writing a research report, which is going to be anywhere between, say, 1,500 words to 2,500 words. And that would help complete the assignment for that unit. This is something that we'll come to a bit later, but because this is a document that we're going to refer time and again during our discussions for this particular unit, what I want you to do is obviously have this document. The reason of providing this in a Word format is so that it is editable. You can start to add your information by visiting the 2 sites, shortlisting a report that you will download, and that will also be submitted along with the work that you submit for this unit, so that It is going to be used as a reference point that this was the report that you have looked at, and then how you've gone about extracting data from that report in terms of introduction, rationale of research, aims and objectives, what was the methodology, literature review which has been carried out, what are the sources towards the end in terms of bibliography, and then finally, presenting, say, for example, extracts from that report as findings and how data was collected, and then meaningful conclusions, which will help you complete and achieve this particular unit. So here we are not going to be actually going to carry out that research. We're going to be looking at a research report. From that report, we are going to be extracting the bits and pieces of information basis what is required in the research proposal template. And that is what we are going to compile to be able to achieve the assignment and this particular unit. Is that okay? Any questions? I've got one or two which have come through. So, okay, please put your email in the chat. That's fine. And I've got that email here, which I've put in. For those of you who don't have it, it's lidc@ukversity.co.uk. And obviously, yes, a copy of this recording is going to be available to you, which I'll show you very briefly before we end today's session, how you would go about getting hold of copies of the sessions and recordings. So let me just share, the screen. And when you look at this, what you need to be able to do is go to youtube.com and type /UK Versity Online. So when you're on this link, I will text it to you as well. When you're on this site, you would go onto the live section. And as you would see, today's session is being broadcasted live. So if I click on this, it will start echoing because I am speaking right now on this session, and this is going to be available as a recording to you after the session has been completed from the YouTube. So what I would do is, obviously, when you're on the YouTube channel, I would go in and obviously click on the subscribe button, which is going to be on the top here. And that subscribe button, when you are subscribed, essentially, if any new video, any new session, which is done specifically for the course that you're doing with us, when it gets in, you would be able to essentially get a notification on your email, and that would allow you to rewatch or watch this particular recording of the session should you need to revisit it. So I hope that is okay, and that gives you, and I'll put the YouTube address here just in case, and I hope that gives you an idea that how would you request or go in and obviously see the recordings. One other thing, I think most of you should have now the access to Moodle. So if I show the Moodle and you would have received the logins, this is the place where you get access to the presentations and the material. I've put that link onto the chat mode right now. So when you log into Moodle, you are going to go into the course. And obviously, when you're into the course, you would be able to see everything that I am actually using and presenting is a part and parcel. And these presentations are all available to you, under this particular unit, which is academic research skills or research skills in health and social care. Obviously, all the presentations, everything is available, including the research proposal template, which are mentioned here, and the two websites that we are going to be using in order to basically cover, the topics or basically look at the topics for research. So thank you so much for attending. If there are any questions, I would want you to ask me now before we end the session, and otherwise I will catch up with you tomorrow at the same time to discuss, the next learning outcome for this particular unit. Any questions, anybody at this moment? Okay, thank you so much for joining. Enjoy the rest of your day, and then we will catch up tomorrow at 11 o'clock.
Thank you.
Thank you so much.
Thank you.
Thank you.
Bye.
Thank you so much. Bye.
Thank you. Bye. Bye for now.